All right. Well, first of all, can I just say it's absolutely fantastic to see so many people giving up their part of their evening to spend some time with Alison and I, which essentially is a new, I think this will be a new way of us talking about things legal. It's not a traditional legal update as Alison or I would normally do. But what we wanted to do was to maybe share some of our experiences, particularly with some of the issues that have popped up in the last year. And as you can imagine, most people will be talking uh, COVID related issues probably for the next year. So as you know, under no illusion that of course we're going to talk about that today, but we thought it might be useful maybe to share some stories, learn some lessons about things that have come up for us. And when we were talking about what our legal issues were for the last year, these were the three topics that came up, which is essentially hopefully returning to the workplace once we've managed to figure out a way forward in line with a COVID secure environment. Although to be fair, I'm not sure I really want to go back into an office again. I'm quite enjoying being at home. And also talking about what the winter plan looks like and how that's going to impact, particularly on businesses in the UK. And then we thought we'd talk a little bit about mental health and well-being, which probably dovetails a lot of the COVID-related issues that have popped up in the last year. So we'll talk about the impact that there has been, particularly on those that are working from home or remote working or doing something very different to what they've been used to pre-COVID. And then we'll end with a bit of a discussion on the fire safety and building safety bills. Again, it will apply more to some than others, but it's more about looking at what it means for individuals within businesses, responsibility, accountability, as opposed to a kind of breakdown of the whole bill, because well, the building safety bill is pretty lengthy and it could take all night. So it's more about taking out those key messages from the two safety bills and what that again is going to mean for businesses. Have I summarised that correctly, Alison? Is that pretty much what we're going to do?
I think that summarised it perfectly. Yes.
Right. We don't, I mean, we have an hour or so with you guys. Please do ask us some questions if you can. And, you know, as you said, Alan said, it's a bit interactive. So we do want to hear from you as well as share our experiences with you. So let's get cracking straight away into returning to the workplace. One of the things that certainly have come up in the last few months, I would say, we've had a couple of formal lockdowns, and some of us may feel like we're still on lockdown. I think we're about to, in London, turn into a tier 3 again because the R numbers have gone up. But there was a whole piece about remote working and what that would and should look like. And when we started, some of the things that I was hearing from clients was, you know, we're having lots of government guidance come out, and um, very it was very continuous, but it was changing all the time, and there was lots of conflicting messages, but also businesses not really understanding what the guidance meant and what the impact would have been to them. So for example, lockdown 1 was very much about foreseeable future, workers should work from home where possible. Then it went to lockdown 2, and it was about what we need to do is save lives. So therefore, to help contain the virus, everyone who can work effectively from home must do so. And the questions obviously came up. What do you mean by effectively? Well, it was all very subjective. So the encouragement was very much to work at home if you can, and obviously to facilitate workers working from home as necessary. Now, that could mean providing the necessary equipment, that could mean ensuring that you've got relevant risk assessments in place, including DSE assessments. So there was quite a lot in it. And I think at first it was felt that working from home was going to be a temporary measure. You know, we'd only be doing it for a few weeks. Here we are now in December, you know, almost 9 months, or if not 9 months later, and a lot of us are still doing the same thing. So the question is remote working here to stay? Is this now going to be part and parcel of the normal way we are going to work, whatever sector we're in, whatever type of business we operate? Is working remotely here to stay? What do you think? What do you think, Alison?
Yeah, I do, I was thinking about this, and when we entered the, you know, as you say, the first lockdown, and we were all me included, because I only brought, a few files home, not the entire office. We thought that remote working was going to be temporary, and we never envisaged, and I certainly didn't ever envisage 9 months later to be still working at home. And when we first started working at home, we had a few questions and from employers saying, do I have to do risk assessments for people working at home? And I think a lot of the discussion at that point was about, look, the guidance at that point was saying not about the COVID, but if you had someone who was off sick, you weren't expected, and they were going to work from home, you weren't expected to go around and check their office and their display screen equipment at home, because they were only there for a day. That was truly temporary. But the temporary has kind of gone into the permanent, hasn't it? And businesses are having now to think about all of the issues surrounding working from home. And I know some people on the call, on this Zoom call tonight, will be health and safety professionals, but also their ambit might also go into the employment sphere. And I think businesses are looking at their entire suite of obligations now that people are at home. It's going to be, of course, it's going to be looking at, what are your health and safety obligations are, but then it's going to be looking at all of those other things like, employment contracts. What is your place of work?
Yeah.
What are your hours of work? As lawyers, we work all kinds of hours, but people have had, traditionally had a 9 to 5 and more flexible, and employers are being more flexible. And so, those issues to be looked at, and insurance and security and there's a whole range of things that I think people are going to have to now look at. But I agree that working at home is going to be here to stay, and I think that's a good thing. But I think employers need to manage that, and manage that well, because a lot of feedback I'm getting is that people are working at home all of the time, and there's a very difficult to, well, I mean, maybe that it kind of goes into the stress part of our talk, is divide up day. People think they're available all the time, and particularly in lockdown, because people know you're at home, so they know you're there, they know you can take their call.
It's been really difficult. I think even for us, we suffer more than most. I know lawyers get bad press, but we suffer more than most because people do think you are easily accessible because you are at home, and therefore the emails do come flying in at odd hours. But in terms of obligations, the only thing I want businesses to know, and this is certainly something that I hope, whether you're a new business, whether you are a seasoned health and safety expert in your field, it always has to start from the basics. And yes, COVID has been new, and it's the pandemic's been awful for a lot of us. Our experiences certainly have been quite difficult and quite stressful, but I think we always have to strip it back to basics, which means figure out what your obligations are as an organization. Those haven't changed. They've been exactly the same, that we've known for the last 40 plus years. It starts off with your typical Section 2, Section 3, your whole premise of looking after the health and safety and welfare of employees and non-employees. That's where it's got to start from. And then my view is, from a business perspective, the people who are pulling the strings in terms of the business duty holders, they have those obligations, but then employees also have their obligations. And that's where we start to see that there are specific duties that we all have to comply with. And therefore it's a two-way process. It's top down, ensuring that the people that work for us and with us are safe, but also bottom up, which means that employees, contractors, agency workers, volunteers, whoever it is, also have their own obligations to look after their own safety and each other, and also to assist those ultimate duty holders with those overarching obligations. And then I think, coming from that, again, those very old doctrines that we know in the Health and Safety at Work Act, then comes our understanding of risk assessment. Now, I may be opening a can of worms here, but risk assessment has been, will be, and is always going to be important when it comes to making sure that we are effectively managing health and safety within our businesses. So again, question came up, and I've got it on the slide. Has anything changed? Well, not really. I mean, the obligation has always been there. in terms of needing a risk assessment. It's a continuing obligation that really shouldn't be forgotten by employers. But I suppose it's what it looks like. What is a well, I could have said this pre-COVID. What does a good risk assessment look like? I still haven't found the perfect one, but it's what does it look like? And the HSE have given, I think, some decent guidance, at least for a starting point, on what a COVID risk assessment should look like.
Yeah, and yeah, I found that a helpful starting point, and coming back to the point you're making about COVID risk assessments, at the beginning, before the HSE put the kind of the template on their website, I was very conscious that a lot of businesses, we saw a shift, in terms of some businesses have a lot of activities and they have a dedicated health and safety professional or somebody who can easily access a lawyer or a health and safety consultant to help them do risk assessments. Other businesses, smaller businesses, weren't used to doing risk assessments. They might have done, very simple ones for manual handling and things like that. But all of a sudden, I had people ringing me who weren't used to really doing risk assessments, and they were put in the position of, I have to do a risk assessment, and actually, if I do this wrong, I'm talking about, a potentially fatal infection, spreading amongst my employees. And I think people were very fearful, and still in some ways are fearful of, putting together that risk assessment, and are worried about, getting it wrong. So I would say to those people that don't have access and the funds, we all know budgets are tight at the moment across the board. Have a look at the HSE's website and their template. It's not perfect, and certainly don't print off their template and put your company's name at the top and think you've done it right, because that's not going to work. But use that guidance. There's some really helpful tailoring to specific businesses. I think there's a factory one and an office one and such like. So have a look at those, because they will give you some useful guidance. And also, I think the feedback I was getting, that people were conscious of this risk assessment being scrutinised more than risk assessments in the past. People were left to their own devices a lot of the time, be able to draft their risk assessments, and off they go, and nobody really bothered the health and safety manager. As long as he'd done his risk assessments and everything was going to be fine, and shared it with who he needed to, that was fine. And risk assessments for COVID are getting a lot of scrutiny throughout the business. The board want to see it and want to make sure, has it all been done properly? Of course, we're going to come on to this about sharing it with your with your employees, and engaging and consulting with them on that. And that's a great, I think that's a really important factor. But it's receiving scrutiny from all angles. So it's difficult. I think it's really difficult for people to address it. And some people haven't gone back to the office since March. And exactly, and me. So people haven't gone back and still haven't grasped that nettle, in looking at the risk assessment. And I think there's a lot to think about in doing that. And one thing that has come up in risk assessments that I've seen, and is something I just wanted to flag for people, is think about, and I think you commented on it as well, Kizzy, right at the beginning, think about how your business interacts with other businesses and other people. If you're in a building, you might have a fantastic risk assessment for your office or your workplace, but if you're sharing that with another business, and you share the lifts, for example, or you share the toilets, you need to think about how they're approaching risk and how that interacts. And I've seen circumstances in which there are shall I say, competing opinions and views on how how those risks should be managed, and that all has to be addressed. So I think it's difficult, but it's something that something that's everyone's got to at least for next year, I'm sure, need to deal with. But
I think you're right. The shared spaces is a key issue, again, because it brings into play multiple duty holders, and we may come across that again when I come to talk about the fire safety and building safety bill, because that's an issue that comes up. Yeah.
Kizzy, I was going to suggest maybe one of the polls you had. I
was just about to say we should put the poll up.
Yeah, I think that'd be quite good to be reflective and just to see what others flag up.
Yeah, let's bring it up.
that the first one?
Let's have a look. I can't see anything on my screen yet, but
One.
because it'd be interesting to hear what you guys, well, it's interesting to see if you're still with us, but also interesting to hear what issues you have come up against, particularly during this quite stressful time.
Has that poll come up on screen yet?
I don't have anything. Not yet.
I don't know if Tony's there, but hopefully this will work.
There we are.
Okay,
I've got something.
good.
Yes, I have. So there we are. So first poll for you guys. We'll give you a few seconds to have a go. What's been your biggest challenge for you and your businesses during the pandemic? Got a choice between home working, reliance on things like this, like Zooms and Teams, managing mental well-being and stress, loss of revenue, fear of business closure, or something else. Just give you a few moments to vote.
Going up and down like my heart rate.
Well, it is. Does that tell us that people are just suffering generally?
General sufferance across the board.
Absolutely. All right, we'll give you another 8 seconds or so.
I think that, I mean, looking at those, they're all factors, aren't they? I think it's difficult, even if I was, you know, if I haven't voted, but if I was going to use any of those, I think they're all factors for me.
I was going to say, I would suggest in the first few weeks, you know, Zoom would have been way up there trying to wrestle with that if you hadn't used it before. But now we're blasé about it.
We are. So we've got a slight clear winner, which is loss of revenue. Not surprising, money is an issue, but also fear of closure, and I think fear of losing jobs as well. I mean, I think people are genuinely concerned about the impact of COVID and furlough, and you know whether or not they can really sustain their business in this climate. And I think it is very tricky at the moment. And part of that will be how do we manage, you know, getting our people back to work once we can get them back to work. And that was certainly the issue after the first lockdown, where people were very energized about getting back to work because it was felt like, okay, we've dealt with that now. We're now back on an even keel. And I think even myself, I admit, I did feel a bit more relaxed about things the second time round in terms of the lockdown, because I think we knew what to expect, but we were kind of prepared for what was to come. And a lot of the measures were in place by then, including the working from home aspect. I don't know if we can stop share results. Can we get rid of the poll?
I think you have to
everybody may have to just click the X in the top right hand corner if you can.
If everybody's still got it on their screen, and if you press the yes, as you said, press the X in the top corner, it'll disappear, minimize it.
So yes, I mean that was a big issue. I think one of the big issues was how do we get our people back so we can start generating business. There was much more encouragement for people to get in if they could get in, and one of the comments I had from a client was it was more like we were not encouraged to go in, but they were saying to us, come in if you can, but if you can't, then stay at home. It was a bit like the Boris message, which was very confusing, but it was rather than, you know, stay at home and work from home where possible, it was more come in if possible, because there was a fear from a business perspective. If we don't get our people in and we don't start doing the work that we're here to do, we're going to lose clients, we're going to lose business, we're going to lose money. You know, maybe that's slightly eased a little bit, but it's still a factor, and I think that clearly shows that it's one of the main concerns for businesses. Dealing with, just going back to the risk assessment point, because risk assessment generally is very important, as Alison has laid out, and it's not just about your office space, but it's about the surrounding office space or areas that will affect your office space. But it's also now, from this working at home perspective, what do we need to do in terms of a risk assessment for people working at home? And again, I say strip it back to basics. It's no different dealing, or not strictly different, dealing with home workers as you would having people in an office. You still have the same responsibilities to ensure that the people that are working at home are working at home safely, albeit you cannot go to everybody's houses or wherever it is that they're working from, and make sure that those areas are safe. But what you can do is use all reasonably practicable measures, which is, you know, you might well give them information or training to ensure that they're carrying out a risk assessment with you. So they're giving you the information you need as an organisation to ensure that they're working safely. It's complying with occupational health requirements. It might well be keeping in touch on the phone and making sure that there is an avenue for them to contact their line managers or someone more senior if they have issues. So it's kind of giving your employees the tools to ensure that they are working safely and they're informing you. And I think that nicely kind of brings us on to the consultation engagement point, which was one of the things that certainly came up from the government guidance when the guidance came out, and there was that whole the 5-step plan, and there's lots of talk about what you need to do in light of COVID related issues. And one of the things was to engage more with employees, and certainly to consult with employees when it came to implementing measures to deal with safety issues related to COVID risks. And one of the things I certainly said was proactive engagement with employees would certainly bat away those niggling complaints from employees who felt they were actually being asked to come back to work quicker than they wanted to, or they just weren't happy with the arrangements that were in place, whether that's working at home or working in an office. They weren't happy. I think if employees feel engaged more, they feel part of the process, they're part of the systems and the policies and the processes that their business is thinking about implementing in light of COVID, then they're less likely to say, I don't like this, I'm not doing this, or I'm going to report you, of which I've had 3 clients who have had issues with employees who have complained anonymously to the HSE, suggesting that they felt that their workplace was not COVID secure, and that resulted in spot checks on site, where the whole thing the last 9 months has been simply COVID related. It's like they've forgotten about our slips and trips and our normal health and safety issues, and it's very focused on COVID secure environments, and do you have the right measures in place, and are you using the right PPE, are you doing the social distancing? It's all been about that for the last really 9 months. They really have been focused. So the HSE are putting a lot of resource into how are you dealing with your employees, are you communicating with them, particularly those that are working at home, and how effective is your engagement and consultation with employees. So it is really important. I found it to be a really important tool.
Yeah, I agree there. It's really, I found that engaging with employees, as you say, is important for many reasons. One of them being that as the COVID risk assessment, it affects everybody in wherever you work. Engaging with everyone in some ways helps you understand everyone's job, and risks that might be particular to them that might not have been considered, and it's good in that stance. But also it helps flag in terms of we're going to come on to mental health, but it flags people's individual concerns, and helps you have kind of like a an early warning system about people who might have specific concerns about coming to work. That consultation engagement also, I think the situations that I've come up against, a lot of it is to do with helping I don't want to say educate your workforce, because that's a bit disparaging, but helping your workforce understand what those risks are and what you are doing to address them. Because I think a lot of the problems that I've seen are people not really understanding what the risks are, and not really fully understanding the steps that are being taken to to manage those and to reduce those risks. And when that's explained, sometimes, not always, but sometimes people feel much more I wouldn't say relaxed, but feel much more confident in then being able to go into the workplace and carry out their daily tasks. Because some people, I'm lucky, I can work home, but some people don't have that choice. If you have to go into work to work, there are all those concerns about is your building COVID secure, and what's going to happen about bringing something back to your family and such like. So we have to be conscious of that. And I think the consultation not only helps you assess your risk, as I say, it helps you flag any potential issues with individuals, but also helps.
We need to think about lone workers as well, We've got to think,
Exactly.
I mean, as much as we've got people working at home, there are those specific requirements to consider lone workers and whether or not there are
Mm,
additional risks for those that are working on their own. I'm thinking more delivery drivers, security
mm,
staff, those that are working in warehouses, those that are, even those at home are
mm,
technically considered lone workers. So again, it's what the HSE are looking for is how our businesses managing the health and safety of those people. How have you done that? By way of risk assessment, by way of action plans.
mm.
It's an acknowledgement that there are potentially increased risks for those who are working on their own, and how you are managing that as a business. PPE. What do you think about PPE? There's a lot you can say about PPE, I suppose.
Oh, well, I mean, I think there was a lot of confusion, wasn't there, at the outset, and that's understandable, I think, because people within the health and safety environment, and many people on this Zoom call will have been familiar with, what we call, the traditional PPE that people needed to carry out their, undertake their jobs safely. But there was a lot of confusion about PPE and face coverings, and what fell into what category and all of that. And I think that's pretty much cleared up pretty much now, and we've got the government website that lists where you need to wear your face mask indoors, and people can look and consult that. I had a lot of questions about face masks and shields, visors and shields. If I'm wearing if someone wants to wear a face mask or a visor, can they just wear a visor? Do they have to wear a face mask as well? And there was a lot of confusion about that for a little while, and now there's some clearer guidance that says, if you're wearing a face covering face shield, you also have to wear a face mask as well. You can't just wear the shield. But there's a lot of issues surrounding that, and issues surrounding people who are managing supermarkets, for example, and have people coming in who aren't wearing their face masks and should be wearing their face masks, and how they can manage that, and how they can deal with that kind of situation. So there are still a lot of issues surrounding PPE and face coverings. I think it's better understood as to what they are now, but there are many situations. I think the education sector, we've had lots of some questions about making parents wear face masks in the the queue at school, and should the
picking up
that, should all of those kind of things. So I think each each individual business and organization probably has its own issues that it has to deal with.
I think also understanding what the regulators are responsible for as well, because there seems to be some confusion from businesses. You gave the example about supermarkets and whether or not the supermarket would then have to make people wear face masks. And again, it isn't actually for the supermarket to ensure that every single customer coming in wears their face mask, because that causes issues for them in their own safety as well. It's understanding that yes, the responsibility as a duty holder in that aspect would be to ensure that you perhaps got your signs up and that you are encouraging social distancing, and you are perhaps encouraging customers that are coming in to wear their face mask. However, you can't enforce that. You're not an enforcer. So it's understanding that asking members of the public to do these things isn't the duty holder's responsibility. In that context, it would be the HSE in some respects, it would be the local authority in other respects, and it's understanding where that line is drawn, because it isn't the obligation of the duty holder to ensure everybody wears a face mask. And again, that was something that came up a few times for me. Tell us a little bit about the ventilation guidelines, because that's relatively new, isn't it? And I think it would be good helpful for people to understand a bit more about it.
Yes, they were updated recently, and I just thought it would be worth drawing people's attention to that, and letting them know they've been updated. And of course, your obligation to have fresh air in the building has always been there, and that hasn't changed in the pandemic. But of course, we've seen that having good ventilation in your building is one of the kind of suite of measures that you can take to make your building COVID secure. So, you know, in addition to the hand washing and the social distancing, ventilation should be considered by you. And those updated ventilation guidelines are quite helpful for you to just have a look at, and they help you identify you know, which areas of your building might not have great ventilation, and how to do that, and then also how to manage that, whether that be by you know, natural ventilation or mechanical ventilation or fans or whatever. There's some kind of helpful guidance on there. And also there's some, I thought, some quite helpful guidance in relation to ventilation in vehicles, because you know, we've got a lot of online you know, stuff going on at the moment, and lots of delivery vans, and you know, people are still in vehicles delivering lots of things. So there's some really helpful guidelines there. So I thought I'd just kind of flag that to people. So if that's part of your business, have a look at that, and you know, that might help you identify poorly ventilated areas and how to manage that.
What we might be able to do is maybe later on, or maybe on a different time, we could maybe post some links to a couple of these things, because I was also thinking about, particularly for newer businesses that are quite interested in looking at a one-stop shop that might help them understand and address the risks and issues in terms of safety, resilience, security, that sort of things. That seems to be some of the key themes that are coming out of COVID related issues. There's an organisation called Resilience First who have put together a kind of resilience package which talks about all the different risk and resilient issues that perhaps businesses should be tackling, including things like cybersecurity, which is not something I particularly enjoy talking about, but it's, you know, it's security, it's health and safety, it's maintaining trust and morale with employees, remote working, which is a key factor, keeping everybody safe, and looking at what the risk assessment looks like. So it takes from the health and safety executives template and also adds to that specifically for specific types of businesses. So if I can find the link, I will post it, but it's a really good booklet. It's an online booklet that talks about all those different types of risks that might apply to your businesses, and what your requirements are, what your obligations are, and how you could potentially meet those. So I thought it was a really good tool that I'd like to share with people if possible. I've put down the winter plan. I'm not going to go into great detail about the winter plan, because I think the government website, I think it's on the Gov website, but it talks specifically about what the winter plan looks like. And I know that will change probably in the next few weeks, but it goes through in detail what the plans are for the government in terms of staying at home requirements, what's open, what's not, rule of six, etc., etc., and then it splits it into tiers and what that looks like. So I think you can look at that at your leisure. What I wanted to talk about, and it's being deliberately provocative because I have my own personal views about it, is this issue about vaccinations. And is that going to help? And I'm trying to tie that into the business obligations and what employers are meant to do, and what they're meant to provide for employees. Is that the sort of thing, i.e. offering vaccinations, is that the sort of thing that's going to mean employers are going to meet their health and safety obligations? Is it going to help them maintain health and safety compliance by offering vaccines, by making sure that the workforce are vaccinated? That means they can safely come back to work, doesn't it? I don't know. I mean, jury's still out for me, but you know, in terms of legal obligations, it's said that they won't be mandatory. So it's a bit like flu jab, isn't it? I mean, we mustn't forget, yes, this started off being the flu. So will it be a good thing for employers to offer vaccinations? Is it the sort of thing they should be routinely doing? And also, the thought that came to my head is, can employees legally refuse to be vaccinated, and what's that going to mean for them? That might be more of an employment question, but what's that going to mean for them if they refuse, and then it has an impact on their ability to carry out their day-to-day job? I think it throws up so many issues. I'm not sure you know, vaccination is the be all and end all in terms of solving the health and safety conundrum.
No, and as you say, it brings up lots of issues, and people have their own, you know, personal views on it. You know, obviously from my personal point of view, for a vaccine to work, you can have an amazing Pfizer vaccine, but for it to work, people need to take it. So you know, a vaccine's only effective if people take it. But of course there are people who you know, can't have vaccines for one reason or another, might not you know, because of religious grounds or other beliefs, might not want to take it. But of course, you know, I don't know, I couldn't predict how many people would take up the vaccine, and you only need to get to a certain number, obviously, to get a nice herd immunity. But in terms of making people have it, as you say, you know, I saw Boris Johnson in the House of Commons last week saying, you know, that's not our way in this country. We don't. That's not the way we do things. And at the moment, as far as I know, there's no you know, plans to make it mandatory. And you know, although you know, the government does have at its fingertips the Public Health Controls of Diseases Act, which they can you know, swing into action with, that gives them powers to prevent or mitigate or contain the spread of an infectious disease. So that there's there, but that does not extend to making people have medical treatment. So that would not extend to, you know, making people have vaccinations. And of course that could change. You know, we've all seen how quickly bits of legislation can swing into place with
coronavirus regulations number 20, you know.
2021. But you know, I think the general feeling in you know, here is that, you know, it's not the way we do things. And, you know, casting my mind to the other side of the pond in the US, I know that you know, there's several states in the US where it is mandatory to have certain vaccines, but I don't, you know, I don't see that happening here.
I think it'd be easy for people to throw up that, you know, it's against their human rights, isn't it? You can just see, well, what that will mean for European courts. I don't know. We won't talk Brexit tonight, but I think it would be totally against people's human rights to suggest that they were, you know, mandated to take these vaccines.
Yeah, exactly. But you know, there are certain sectors that, you know, I think it's going to affect more than others. You know, the healthcare sector already has you know, duties to ensure that their doctors and nurses don't infect the patients with infectious diseases. And that's why, if you're, you know, I'm not a doctor or a nurse, but you know, that's why if you're a doctor or a nurse, you have, you know, various you know, inoculations that, you know, to make sure that you are immunized against, you know, communicable diseases that you could give to patients. And I think those, you know, maybe those settings are going to be you know, facing more difficult questions in terms of their employees, you know, because they're coming into contact potentially with vulnerable, you know, vulnerable people. So
yeah,
there is that issue there, you know. So and in terms of the flu vaccine, you know, I've worked for companies where we're all offered the flu vaccine, and let's take it up because, you know, it's a good way of not getting back to work, but as you say, I don't think at the moment we're going to see a mandatory request for it to be done.
I think at the moment it's got to be, if the question is how do we maintain health and safety compliance during this COVID pandemic, it's got to be go back to basics, go back to the things that certainly have been entrenched in our minds about how do we keep our people safe. And it's got to be a focus on risk assessment. It's got to be a focus on ensuring that we have got the right measures and policy. Have a look at our policies, have a look at you know, what they look like, and do they do what they say on the tin? Do we engage actively with our employees, and are we, you know, ensuring that the people that are not in our offices anymore and are working remotely are just as safe as those who would be working in an office, and perhaps more visible to senior members of teams?
Yeah, and I think
all
we're
right,
going to have one final point like that.
Yeah,
just because of the events of this week, and you know, we've seen you know, people start having the vaccine, and I think employers are going to be faced with kind of, for a while, like a two-tier. You're going to have some of your employees who are going to be vaccinated and some who aren't, and you know, how are you going to manage that in the workplace? And I haven't even started putting my mind to that yet, but it just occurred to me this week, you know, you're going to have a certain section of employees vaccinated and a certain section not. Some might still have to work from home, some not. You know,
some might be able to travel, some not. I mean, this is the next thing. You can just see how this spirals out of control.
Yeah, we could be talking about forever, so we shall see.
Absolutely. All right, so moving on to perhaps how things have been dealt with over the last few months in terms of active investigations and prosecutions. I've seen a few investigations. I haven't seen any prosecutions per se that are solely related to COVID issues, but there have been a few investigations I've certainly come across, and I know Alison you have as well, that deal with generally a lack of risk assessment. As you can probably imagine, they look at risk assessments and they don't feel they're suitable and sufficient, which is always a nice add-on for the HSE anyway. There have been issues around a lack of social distancing measures in place, so not separating desks or that sort of thing. Those seem to be some of the issues that have come up for me, and also this idea about how are you communicating with staff, and there seems to be a bit more of a focus. We'll talk a little bit about that in a minute, but there's a focus on the mental health, occupational health issues, and how they are dealing with that, it's becoming a much more tangible topic for the regulators than it was in the past. I think the HSE shied away from talking about things like stress and mental well-being in the past. It's been such an important part of health and safety in the last couple of years. I think they've had no choice but to grapple with it, and we'll kind of see, we'll talk a little bit about some of the cases that they've actually seemed to pop up in. But I think things for people to remember in terms of investigations and prosecutions is having a look at what some of these regulations talk about. We've had the face coverings regulation, which is relatively straightforward. We've now got self-isolation regulations, and again, we're seeing a few of these come through the gaps where people are testing positive for COVID and they've got obligations to inform their employers. They've got the obligations to self-isolate. Employers are not allowed to ask people to come back in if they are due to be self-isolating. And these are, what we have to remember is these are criminal offences. So these have become law. We're not in the space of this being government guidance anymore. The UK certainly are not shy in making these become regulations and therefore law. And it's the fact that the penalties themselves are quite significant. It's a tiered approach where the fines can begin relatively small and go all the way up to £10,000 for repeat offenders. So I think people need to understand that those self-isolation regulations, if you are testing positive for COVID, or as an employer you have been notified and you allow your workers to come back in for whatever reason, again, it's a commission of a criminal offence for which you can receive serious financial penalties. And then there's also the issue around reporting COVID matters to the regulators. And again, when we started, everyone was worried that, oh my God, if we start reporting that we've got suspicions of COVID or someone's got symptoms, do we then have to report that? It was to Public Health England at the time, but then it was, do we have to report that to the HSE? And yes, there are certain situations under which you would have to report COVID related risk. But I think go back to the HSE's website, and it's quite specific. They've refined the advice on their website, which is why I'm directing you to it. And it talks about exposure to the risk of contracting the virus. It's not about whether or not someone has contracted the virus, because the question comes back, well, how can you prove they've been exposed to the risk at work? Well, it actually doesn't really matter. What matters is your measures and the steps that you've got in place to mitigate the risk of them contracting the virus. It just so happens that perhaps someone has contracted the virus, or maybe not, but it's the fact that the regulators feel that you have potentially exposed someone or people to the risk of contracting the virus. But what you have to remember is it's got to be an increased risk over and above what they would normally be exposed to. And that's the thing that I think may have got lost in the HSE's guidance, is that it's not about just simply exposing, it's about, have they been exposed to an increased risk of contracting the virus. So again, it's some certain things to think about, certain things to just have a look at in terms of what the themes are, the trends are for the regulators. And there certainly are a few examples that I've come across. As I said, we've had random whistleblowers, aggrieved employees who are suggesting that they've been asked to come back too soon. We've had random spot checks on sites where the HSE have suggested, as I said, risk assessment not suitable, or a lack of measures in place to ensure that this is a COVID related, it's COVID secure environment. Alison, have you had some similar thoughts?
Yeah, and just to sort of build on some of the points you've made, I've come across very similar things. And one of the other things that I was thinking about that the HSE has raised is the the training of the workforce in relation to the COVID measures. And that kind of harps back to my pre-COVID days, and I'm sure yours as well, Kizzy, in terms of if clients come to us and they're being prosecuted and they give us their great suite of risk assessments and method statements and all of what's in their files, and it actually turns out it's just because they dusted it off the day before they've given it to me and nobody actually knew about it, or it wasn't, no one was trained on it or repeat trained on it and such like. I feel like it's kind of harping back to that element of the HSE's previous psyche, that it's all great to have this amazing risk assessment, but people need to know about it, people need to understand it, people need to be trained on it. And I've seen a few circumstances where they say, yeah, you've done this, but actually no one knew about it, or it wasn't being implemented, of course, as well. That's a common issue across the board with HSE prosecutions, that people have these great systems, but
no one knows about them.
No one knows about them, and they're not actually being implemented. So on paper it all looks great, but actually the word on the street is a lot different. So I think training is an issue, and I still think there is an issue. You talked about whistleblowing, of people being reluctant to whistleblow and expose their employer, particularly these difficult times. I think it's difficult. Employees don't feel empowered to do that. I was reading as well a report last week where they asked, I think they had asked like 16,000 people, would you know who to report, an un-COVID secure issue at work to, and 50% of the people had no idea who they'd have to contact. And only, I think it was like 8 or 10% of people said, I know it's a local authority perhaps, or the HSE, but and that was really surprising to me, that people wouldn't know who to report to, and also people don't feel empowered to do that. And I think that's a real, that's a problem.
But that's where the engagement comes in. I think if you engage with your employees effectively at an early opportunity, you're definitely going to mitigate the risk of them potentially being aggrieved and feeling like they have to report to an authority, as opposed to going back to their business and saying, look, we think you should be doing this, or we're not comfortable with this, can we have a chat about it? That's I think I'm all for conversation, to be honest. I'm much more about conversation and less about let's get the authorities involved.
Of course,
you don't need to.
I was going to add, I'm conscious of time and the need to engage with our audience as well. I mean, it's been absolutely fascinating listening to you. I know you've got a couple of more slides and things.
Well, we're happy if there's any questions related to kind of COVID related investigations, or perhaps compliance with obligation. Let's see if we can take a couple now.
Yep. I think we're still compiling those, so if you
right, well, let's carry on.
Carry on for a minute.
Let's carry on. I've put a couple of examples there. So again, if you are interested in perhaps some of the examples of the COVID related investigations that are ongoing at the moment, there was a very public one with the DWP, Department of Work and Pensions, being hauled over the coals, I should say politely, by the HSE. But again, for similar topics that I suggested, it's about not having adequate walkways that were distant enough. They were actually criticised and they're being investigated under Section 2 of the Health and Safety at Work Act, and it was said that they didn't look after the health and safety of their employees, so they've exposed them to risks to their health and safety, which we knew was going to be the case. If they're going to be prosecutions, they're going to be breaches of Section 2 and Section 3, aren't they? So they said that the DWP had tried to take urgent action, but again, it's just things that they should have known as well-known, resourceful duty holders, and these were very simple things that they could have put in place and they didn't. So you know, they were publicly shamed, as I say, named and shamed, and they've now learnt from that lesson. But as I say, there's an increase in the spot checks, lots of inspections going on, particularly in the north of England, and those tier 3 areas. And again, the HSE are very vocal about that they will now be proactive about investigations.
Yeah,
so
and maybe
something to look out for.
Just as a kind of a last thing on that slide, and I know we're under time, but I just thought it'd be useful to flag that I saw this week that the HSE are now at the moment currently concentrating on transport and logistics. They issued a press release, I think, in the last week,